National health care for firefighters. I think it's a very complex issue in terms of where we collectively bargain and the different, I think it goes back to something that Kelly mentioned earlier with collective bargaining. Everybody's process to achieve or secure some sort of national medical or any kind of medical is unique. And so I think it's something that we need to take to the membership. We need to vet fully. And if it's the way that this organization wants to go, then we need to take it to convention floor, ask our executive board and our leadership and our IFF to try and move forward and pursue it and secure that for firefighters throughout the nation. But remember, we also support or also have Canadian members. So we need to make sure that we're mindful of our entire international union states.
So I think this is where having been around, experience matters, because we've seen these resolutions come to the International Convention before about national health care. And we have not been successful at that, and probably for a number of the reasons Ryan just mentioned. But I think it's a fantastic idea. We should be looking at national health care for firefighters. And that's what we did with the Northwest Firefighter Trust, and that's what's happening right now, is that organically that's growing. Not because it had to go to a process at the international, but the Northwest Firefighter Trust is garnering enough interest around this country that we're getting calls now from Florida, from Illinois, from Connecticut. How can we be a part of this? And at some point, if we build the base and the foundation for it, it won't be a big leap to make it happen nationally, and people could start to join it. And it really, when it comes down to employers, if they can save a buck, they don't care about collective bargaining. They'll jump on it if it's beneficial to them and to the cost of their health care for their firefighters. They'll jump on it. It's not about collective bargaining at that point. It's about them trying to save some money. And if they can, and unfortunately, them trying to shirk their responsibility to the health care of their members. They'd much rather have somebody else take care of it. They don't want the liability. They don't want the pain that goes with having to provide medical for their employees. So, Tom, I support it. Looking at the camera, I support it, and we're working on it.